In the preparation for surgery, what we will be looking at is to make sure that the patient stops any anticoagulants. So they would need to stop the warfarin for 5 days prior to the procedure. And if they're on aspirin, they would need to stop the aspirin for 2 weeks prior to the procedure. The day before the procedure, we would recommend that the patient has a shower with Hibiclins, because to try and minimize any possibility of developing infections during the procedure. During the procedure itself, we would do a preparation, and normally a patient would get a shaving of the groin, and the whole area is prepped and draped, and the prepping takes up to about 10 minutes or more with betadine solution, and that is again to try and minimize any possibility of an infection. The possibility of an infection with taking all of those precautions and with the antibiotics that the penile implant is impregnated is less than 1%. Once the patient has had the procedure, we would organize for the patient to have a scrotal support. They would have an ice pack that would be applied in the scrotal area, and that would be in the first 24 hours after the procedure. The next day the dressing comes off and the patient can be discharged the following day. What we would recommend also is that the patient, once they are discharged, just for their comfort as they're recovering and convalescing, at the comfort of their own home, they can apply a bag of peas in the scrotal area, and that would apply some relief, both by applying a bit of cold and a bit of support of the scrotum. In terms of the infections, to try and prevent the infection, again, it is of paramount importance that the patient continues with antibiotics for a period of 5 days. They would be given ciprofloxacin 500 milligrams twice a day to go home with for a period of 5 days. In terms of pain relief, the procedure itself has got some pain associated with it. However, with simple analgesia and with the bag of peas, a lot of that discomfort can be settled. Normally, the patient would be advised to take some naproxen slow release, which is 750 milligram, one tablet once a day, and that would suffice for the pain. After a week of the implant insertion, patient will be followed up in the rooms. We will be looking at the wound, we'll be looking at the scrotum, and make sure that everything is looking good and that there is no infection in the wound. At 3 weeks, what we would do is a part of the follow-up would be to get the patient to come to the rooms again, and we would inspect the whole wound, which should have been healed by 3 weeks. And also we're looking at the pump in the scrotum, make sure that the patient is kneading the pump and it's bringing it down into the scrotum, into a dependent part of the scrotum, so it's going to be easier then to use and to pump the cylinders. At 6 weeks, patient is shown how to pump the cylinders, and we then deflate the cylinders at the time, and patient then does that himself so that he's able to completely use the device. From 6 weeks onwards, patient is able to use the device for sexual intercourse. When the man wants to have an erection, he obviously starts from a non-erect penis and a flaccid penis. The only thing he has to do is actually reach for the pump in the scrotum, give a few squeezes to the pump in the scrotum, and the erection will take place. The fluid from the reservoir will go into the penile pump and will inflate and will cause an erection. The erection is a hydraulic event, and this is the fluid going from the reservoir into the penile pump. When the man has finished the lovemaking, then the only thing that he needs to do is to press on the bar, which is adjacent to the pump in the scrotum, and the erection will deflate with the fluid going back from the cylinders in the penis into the reservoir. Erectile dysfunction is a common problem. if you do have a problem with erectile dysfunction, there are solutions to the problem which can be short-term or long-term solutions. If the problem, however, is more long-term, there are solutions for the long-term problem with erectile dysfunction. The most reliable solution would be an insertion of a Titan inflatable penile prosthesis. Talk to your doctor about the problem, and then the next step would be a referral to a urologist that has got a special interest in erectile dysfunction and has got the expertise in performing a minimally invasive surgical procedure for inflatable penile pump devices.